Next we have Erica Fricke, who is Chief of Staff for Representative Dan Frankel.
Hi, the representative could not be here today, but he wanted to make sure that his concern about the vote in the House of Representatives was known, so let me say a few words. The proposed funding cuts to Planned Parenthood and Title X are part of a nationwide attack on progressive programs and progressive values. But what must not get lost in these discussions is the real impact that these programs have on women's lives. And from a policy perspective, that means looking at the statistics, which are staggering. Almost 30% of women-headed households live in poverty. And those young women most likely to use a federally funded family planning clinic, women between the ages of 18 and 26, almost a quarter of them nationally are poor. More than a third of those young women living in poverty have no health insurance at all. And these women come to Title X funded clinics for their most basic health care. They rely on the Planned Parenthood network of health centers not only for reproductive health care, but sometimes for all of their health care. For many women, this may be the only medical visits that they make. It's clear with the news coming from Washington, D.C., as well as from states like Wisconsin, that the far-right wing sees an opportunity to totally undo the progressive victories of the last half-century. That's not the kind of governing that makes sense. One of the most important roles of government is to care for the most vulnerable, and too often, that means women. Our senators will be receiving a letter asking them to reject this egregious attack on a vital program that would have a devastating impact on vulnerable constituents in the 23rd Legislative District and across Pennsylvania. Hopefully, they will recognize that Pennsylvanians do not want us to step backwards in time and will continue to fund these vital programs.
Thank you, Erica. Okay, and next we have Samantha Pavlik, who is a nurse practitioner here at Planned Parenthood, and just will say a few words about her experience serving clients.
Thank you. Hi, my name is Samantha Pavlik, and like Kim said, I am a nurse practitioner here at Planned Parenthood. I work in the family planning clinic upstairs on the 3rd floor. I love working here. It's probably one of the best jobs I've ever had. And I kind of get to see the Title X dollars in action. On a day-to-day basis, I typically see between 30 to 40 patients, give or take, both men and women who may not have access to basic preventative services if it weren't for the Title X funding. I wish I could give you an example of what a typical patient is for me, but I honestly can't. That is because we see patients from all walks of life and all ages. Our patients include both men and women and can range from teens to menopausal women in their 50s and 60s. We provide breast and cervical cancer screenings as well as HPV testing. In 2010, we provided over 250,000 blood pressure screenings, and that's in all of Pennsylvania, all the Planned Parenthoods. In over 10 years in Pennsylvania, we've done over 3 million blood pressure screenings. Our clinic provides testing for sexually transmitted infections, HIV, counseling, and provision of birth control. Many of our patients rely on us as their sole providers of health care. About 75% of our patients receive free or reduced care through Title X funding. During these difficult economic times, we need to be able to provide affordable care that is accessible to all people. Title X and Planned Parenthood help ensure that this care is available to anybody who needs it. Thank you.
Thank you, Sam. And then our final speaker is Jessica Dickinson Goodman, who is a client and has just a few words she would like to say about the value of the services that she receives through the Title X program.
Hi, my name is Jessica Dickinson Goodman, and I'm a poor college student. Planned Parenthood provides me with my primary care in Pittsburgh. I've come here for checkups. I'm also a volunteer because this is the place I've been treated with the most dignity and professionalism of anywhere I've sought treatment in Pittsburgh. I'm here I have 2 stories to share from other clients who weren't able to be here today. The first is from Alexis Miller of Polish Hill, Pittsburgh. She says, "For close to 10 years, I have and continue to take advantage of family planning and routine health services at Planned Parenthood of Western Pennsylvania, including yearly checkups, contraception, and other important tests and services. This place is about so much more than abortions, and in fact less than 10% of their services. I have relied on the discounted and free services when I was working as a young waitress with no health insurance, again when I was working for a nonprofit organization with limited health insurance that did not cover these family planning gynecological services, and again when I went back to graduate school at Carnegie Mellon University and could not afford the co-pays of visits and medicines with my insurance. I currently have finished my master's degree and continue to work serving my community in the Allegheny County Department of Human Services. I will continue to attend Planned Parenthood without the discounted services because it is a quality program that is important for all women, regardless of income. Without the discounts that Title X allows Planned Parenthood to pass on to me, I know that I would not have received the care I did or the services that I did. I simply could not afford them during those periods in my life, but now that I can, I have not forgotten what they have done for me and what they do for so many women in my community. I urge Congress not to take this important health care away from women. The costs of unintended pregnancy, sexually transmitted diseases, and other gynecological problems that go untreated will certainly replace the costs of Title X funding if these services are not available to those with low income. The second story is from Kim Underwood, also Pittsburgh. She says, "Several years ago I changed employers. Like most young adults in my position, I opted out of COBRA coverage. It was far too expensive, and I was a healthy 21-year-old. However, I did find it necessary to go for my annual exam. Because I was without insurance, I went to Planned Parenthood because I knew they would perform the exam without breaking the bank. After gaining health insurance with my new employer, I decided to continue visiting Planned Parenthood because I felt comfortable there. It's a rather intimate exam, so for any woman it is important that one feel comfortable with their doctor. Unfortunately, I had a pap smear come back abnormal. They asked that I come back in for a recheck 3 months later. I was sure it was nothing. I went back, and unfortunately it was still abnormal. I was then advised to have a colonoscopy. I have no idea why this was occurring or what it meant. I just knew I was scared. My doctor was sensitive to my fears and educated me on HPV, something I'd never heard of. I honestly thought all sexually transmitted diseases were something dreadfully obvious. Boy, was I mistaken. I came to learn that some forms of HPV are seemingly symptom-free but can cause cervical cancer. This was the form of HPV I seemed to have contracted. Planned Parenthood referred me to a gynecological oncologist who would be better suited to treat me. The doctor went on to perform more colonoscopies and additional types of biopsies. It seemed like an endless process of poking and prodding. Thankfully, today I appear to be free back to normal. I'm also thankful that the folks at Planned Parenthood were there for me when I was scared beyond belief. Do you know, they even called after referring me to the oncologist to check on me. They wanted to see if I'd made my appointment. I had, but it was nice to know how passionate they are about every woman's health, even mine. Planned Parenthood was there when I needed affordable health care, educated me without ridicule, and potentially saved my life. I will be forever thankful that Planned Parenthood caught this and insisted on further treatment. I'm sure my story is just one of very many. Planned Parenthood has been the place for women to go for affordable health care. Without Planned Parenthood, many women would likely skip that annual exam because they don't have any symptoms of something being wrong. After all, I had no symptoms.
Thank you, Jessica. So we're happy to answer any questions that you might have. That ends our formal presentation and all of our presenters. So does anybody have any questions for any of our speakers? Okay, great. Well, we will linger around here for a few minutes afterwards if you want to speak to anybody individually. Thank you so much for coming today. We appreciate your support and your interest. This is obviously critically important to us and to our community, so thank you.